Hi everyone, I'm Dr. Mark LeMay and I'm here at the Oakland Convention Center for a 2-day seminar on the Botanical Wonders from Down Under, so I can learn from some of the top herbal practitioners about how we can use functional herbal medicines so that you can live a healthier lifestyle. And we're going to be interviewing them, so you get to hear from them directly. Hello everyone, I'm Dr. Mark LeMay and welcome to this week's edition of the Wellness Connection. We have a special guest with you here, Professor Kerry Bone, all the way from Australia. And so we wanted to just kind of give you an idea of what are his credentials. Okay, so Professor Kerry Bone is a practicing herbalist, co-founder and head of research and development at MediHerb, and principal of the Australian College of Phytotherapy, working for the Australian College of Phytotherapy and in conjunction with the University of New England. Kerry has also developed a master's degree program in clinical herbal medicine. In relation to his work, he was appointed associate professor by the university from 2006 to 2012. Kerry was also recently appointed the adjunct professor at New York Chiropractic College. So, Kerry, welcome to our program here today. And I got a question for you. One of the biggest things I hear all the time in practice is that herbs are not safe for us. Could you address that issue?
Well, I think fundamentally it's propaganda, isn't it? Because herbs are safe, and I've now been in continuous practice for 34 years. Now, there are rules you have to follow, issues like herb-drug interaction, safety in pregnancy, and such. But having been in practice for 34 years, I have to say I have never had a serious adverse event in my practice. But I think it underlies a very important consideration, and that is, if you want to take herbs, you should get them from someone who's trained, from a clinician who knows what you need and knows what you're taking in terms of the drugs and knows what's safe to give you. So you need expert advice, and as long as you're taking herbs under expert advice, and importantly, using high quality products.
Yes.
Because adulteration is often responsible for many of the safety issues. As long as you're doing that, then herbs are incredibly safe, almost amazingly safe.
And again, it's really interesting that you say that too, because I hear from other practitioners like, well, there's really no research about herbs as far as their safety and their clinical application and how effective they are. Is that true?
There's an abundant research on herbs, both in terms of their quality, safety, and efficacy. In fact, I have trouble keeping up with it now. And honestly, it takes me several hours every week just to review what's being published in the field. So this is a very actively research field now, and we're generating high-level evidence. And indeed, we can think of examples like disease modification in osteoarthritis and helping hit many targets, for example, in people with poor immunity, how herbs fulfill a role that you just can't fulfill with drugs.
Yeah, and that's exactly what I see in practice too, because I've been using a lot of the herbal preparations from MediHerb and getting very good results with those. So speaking of that, as far as results, could you give us like a case history or like a case study that you've done with somebody recently, like with herbal practice and kind of the outcome that you've gotten?
Yes, absolutely. And when I set out on my herbal journey, if you like, I set myself a fairly simple task, and that was to make a significant difference. A difference that possibly could save a person's life in someone's health that was genuinely attributable to the herbs. And the case I'm thinking of, exemplifies that perfectly. This is a patient with chronic kidney disease. He had a GFR, which is a measure of kidney function, in the mid to low 20s. Now, normal kidney function is 60 or 70 or higher. So what I did was I put him on echinacea for his immune support, because there were some autoimmune aspects to it. I also gave him a protocol for his microcirculation, which is a dietary protocol that included things like bilberry, cocoa, garlic, green tea in his diet. And then also I gave him a microcirculation herbal product, which had gotu kola, ginkgo, and grapeseed in it. So his kidney specialist said to him, you'll be on dialysis in 2 years. Your trajectory is very low, and once you get into the 20s, I've never seen it reverse. So 2 years later, that patient's GFR was normal in the 70s. And now another 5 years after that, he still keeps on the herbal regime, but his GFR is still completely normal.
And that is a great way to, just say that herbal preparations, good, high quality herbal preparations, what they can do and what kind of an impact they can make on patients. And just so you know, Professor Bowen, I totally agree with you, because I've been using them now for the last 4 years, and I have seen great results with my patients in different areas too. Not like the one you just told me about, but I have seen really great results with my patients too. So thank you very much, because he is one busy guy. And we were just so thankful that we got a chance to actually even get you on our show here today. So thank you very much for being a part of our show. And we really appreciate you coming all the way across the pond again to visit us here in California.
It's been a pleasure, and thank you so much for your interest in your work with herbs. I do appreciate it.
Hi everyone, we're back, and I've got another special guest for you guys here. We have Berris Burgoyne. And let me give you her credentials. Berris is a renowned naturopathic clinician with 25 years experience. She owns and runs a highly successful naturopathic clinic in Brisbane, Australia, which is a beautiful place. We've been there. It is gorgeous. And she is a senior member of the MediHerb team as a clinical support consultant and technical writer and educator. We just got done listening to 2 different presentations she did. And the one question I got for you here from the first presentation she did was on cardiovascular health in women.
Yes.
And it's really sad, but it's the #1 killer in America today is
It
cardiovascular.
absolutely is.
And it's like, so could you explain a little bit, what are some of the things women should be looking for to kind of like, okay, you might be having problems with your heart.
Okay, right. But even if you're not having problems with your heart, because you may not know you have a problem with your heart, and most of the heart tests that are carried out routinely are things like CT angiograms, where you go into the CT machine, they check your heart, the coronary arteries in the heart, and also coronary calcium scores.
Yes.
And what those tests will show, if you've got any plaques in the large coronary arteries, that's great in most men, because that's the sort of heart disease that most men have. But a lot of women, and in fact most women, do not have that sort of heart disease. They have the plaques in the fine vessels that feed the heart.
Wow.
And when they do those standard tests, you don't see that.
Yeah, you don't see any of that.
You don't see it.
Oh, so you're fine then, right?
That's right. So doctors will say, oh, great, we'll do all these tests to make sure your heart's good. Great, your heart is good. It may not be good, because you may have the plaque in those fine vessels. So my advice to all my female patients, particularly over 35, is to tell them to go and have a test called an echo stress test. So it's like we all know about the ECG stress tests.
Yeah.
This is an echo stress test where they check your heart with a CT scan before you exercise at rest, and then they get you on the treadmill or the bike, get your heart rate up, then you lie down and they test it again while your heart rate's up. And with that echo stress test, they can tell if there's any areas of the heart that are diminished in blood supply, and if that's the case and you don't have plaques in the coronary arteries, chances are you do have plaques in the fine vessels. And that's a really good thing to know if you've got that, rather than thinking, oh, my heart's fantastic. It may not be. And it's good to know that, because there's a lot that we can do to help that and keep women healthy with that. It's important to know.
So in other words, what you're saying, Berris, is that we can't treat women like men. We have to take a look at them differently than what we do like for men. Correct?
Exactly. We cannot treat women like men. And the confusion comes about because up until very recently, and even now, the majority of research on cardiovascular disease is done in men, not women. So most things we know about heart disease, we learn from men, not women. And in fact, American female cardiologist, wrote a book called women are not small men. Absolutely reflecting this, and I think that
That's
says
great.
it all,
That's
right? Absolutely.
So, knowing that, and by the way, thank you so much for sharing all this with us too, Berris. We really appreciate it. Can you give us an example, like a case study of something that you've seen in your practice?
Okay, so I had a female patient in my practice. She was early 50s, so post-menopause, and she came in for a whole range of things, but one of the things that I elicited during my questioning was that she sometimes gets some chest pain. And she said, well, you know, I get a little bit stressed, a bit anxious, and that's probably what it is. And I thought, well, maybe that's what it is. And have you had any heart checks? Yes, because I get this chest pain. My doctor did all those other tests. He said my heart's absolutely fine. I said, well, it may be, but let's just get this other one done. I said, go back to your physician and ask for this echo stress test, which is exactly what she did. She came back and she said, guess what? My heart wasn't performing in some little areas as well as it should have.
Yeah.
And that doesn't show the plaque, but it indicates there's a lack of blood supply, probably from plaques in those fine arteries. So it was great for her to know that, because then I could give her some herbal remedies to help deal with it, point her in the proper lifestyle factors, and all the things to look out for. Next time you're having that chest pain, you go to the ER and you insist on getting proper tests done. Don't let them tell you it's anxiety. Get the tests done. It might just be anxiety, but my goodness, you want to know for sure, right?
Correct, because the number one killer of men and women today in the U.S.
In fact, heart disease kills more women in the US than all other causes combined.
So this is important.
And it kills more women than men. So all you ladies out there, please take care of yourselves.
Yeah.
Go and get these tests done.
Yes.
Get them all done, not just the echo stress test, get them all done. Because you might have plaque in the large arteries as well.
Yeah, and so, you know, I am so thankful that we have Berris Burgoyne here with us, because last time she was here was 4 years ago, I think, and it's so we don't get to see her very often, so we're very blessed to have her here today. So Berris, thank you so much for being with us here today on the Wellness Connection, and we'll see you next time.
Thank you.
Bye-bye. Hi, everyone, and welcome back. Today we have a special guest for you here today, Samantha Williams. Amanda, thank you very much for being with us here.
Pleasure, absolute pleasure.
So let me just give you a little bit of background on Amanda. So Amanda is an internationally experienced integrative naturopath and medical herbalist. Amanda has over 20 years of clinical experience in practice. She specializes in integrative endocrinology for women. Amanda has dedicated her clinical practice to discovering and addressing the underlying cause of ill health to deliver long-term sustainable health solutions. So I got a question for you, because she did the presentation just a little while ago talking about how they take the different herbal products, basically going from seed to clinic. And I hear this question all the time, and I want you to address this for a minute. It's like, patients will come to me and say, well, Dr. LeMay, why do I need to get St. John's wort from you when I can just go over to Costco and get it there?
Well, that's the perfect question, isn't it? And I get this all the time in my own clinical practice in Brisbane, Australia, because we have patients that come in maybe for the first time and they bring all their supplements that they have at home, and I then go through all of those supplements and explain why what I use as a professional and a specialist in particularly herbal medicine and naturopathy, why what I choose is so particular, because I obviously investigate the companies. I want to understand what quality parameters they put into place, what geniuses in terms of their scientific people and their laboratory facilities, etc. Because just because something might be St. John's wort, it isn't necessarily St. John's wort that's going to confer those clinical effects to alleviate mood, work as a superb antiviral as well. And so if we use St. John's wort as an example, there are many what we call phytochemicals, so constituents or compounds in the plant that work together to give it its clinical results in the body, i.e. helps you feel better. And so if we think about St. John's wort, many products that you might see in GNC, as you mentioned, or other stores, they will have something marked on the label which is called Hypericin. Now, Hypericin is one of these many plant compounds that can give a result in terms of alleviating mood, making you feel happier. However, it requires other compounds within the plant to make sure it is what we call bioavailable. So therefore it gets into the bloodstream and then is able to do that job. And those things are called flavonoid glycosides. Now, I know all of this sounds quite scientific, etc., but I just want to assure you that there is a number of compounds. So there's flavonoid glycosides, there's something called hyperforin. So there's all these different things in plants, and that's why we need plant experts, herbal experts, who research these plants to understand what is it that works within the plant to ensure that we get the great results in our bodies and for us as clinicians with our patients. And unfortunately, plants are very complex. And I've mentioned a number of things in St. John's wort, but that's certainly not the complete picture for St. John's wort. And if we go on to look at all the other plants that we use, the botanicals, they're incredibly complex. They have an amazing ability to work very effectively in the body. They have an evolutionary ability to be really integral with our body's chemistry. So we call that pharmacognosy in terms of how it works within the body. And in order to ensure that we can have the best quality, it starts with the herbal farmer. And I choose to use MediHerb because in my clinical practice, I've seen better results from MediHerb than I've seen with any other products I have used in terms of herbal products. And MediHerb works with those herbal farmers. They have a specific team of people that actually go out and visit farmers all around the world. They develop these amazing relationships that span back over 30 years to ensure that we get not only the best quality, but we have a sustainable supply. Because as we all know, being a farmer and working in agriculture is incredibly difficult these days. And so, you know, with the climatic conditions and the variability, we need to ensure that we have a sustainable livelihood for our farmers.
Yeah.
And in particular, our herbal farmers, and that we source the best quality. Additional to that, there are a lot of companies, big companies, that sell herbs, you know, in terms of raw herbs, to companies that then manufacture herbal products. And unfortunately, some of those companies aren't as ethical, and so we get very poor quality products. And an example I used in my discussion today, my presentation, was one herb that is often substituted with another, and that's the herb skullcap. And it's often substituted with another herb called teucrium, because it's much cheaper to grow, and that's called economic adulteration. But unfortunately, this herb called teucrium is actually toxic to our liver and actually can kill you. So these are the things that we're talking about in terms of, it's not just about quality and about making sure that you are getting the right quality to have the clinical outcomes, but about them being safe, you know, and we don't know what we're buying. And in that example with skullcap, there was the US Department of Agriculture sourced skullcap products from the internet in the United States, and they found over 40% of them were not actually skullcap, and that they were substituted with another herb. Now that's dangerous.
That is dangerous. So it's like, and correct me if I'm wrong on this, but it's like, if you're gonna make a cake, you know, like a chocolate cake, you wanna make sure you have all the right ingredients. And if you don't have all the right ingredients, you may end up with, I don't know, pineapple upside down cake versus a chocolate cake. And that's kind of like what happens with herbs in the United States today, because I always compare herbs in the United States as like the wild, wild west. We do anything here and call it, you know, skullcap or something like that. But you go to Australia, and that's the one thing that really impressed me when we visited MediHerb there, is all the herbs and how well they check them. You know, when you go there and you see how well they check everything, it's amazing. It's just like, I always tell, it's like I compare these guys to like Disney World, you know? It's like going there is like Disney World. They're that good at what they do. It's like the happiest place on earth.
Well, MediHerb's the most herbal place on
Earth,
right?
there you go, the most MediHerb place on earth. Yeah, herbal.
Yeah.
So could you give us an idea, like say like because we're talking about this, why don't you give us like, do you have a case study that you can kind of explain, like why are the herbs so good?
Yeah, well, I think I'll use some of the, one of the cases that I just spoke about in my presentation where I had a patient, he was a non-patient when he actually had a very severe fall and did an incredibly complex injury to his wrist.
Yes, that was a good case.
Yeah, so this particular injury is called a scapholunate ligament tear, which I know sounds bizarre, but you know,
he hurt his wrist.
He hurt his wrist very, very badly. And he went in for very complex surgery, had the surgery, wires, pins, and a transplant of a ligament, essentially. And he started taking the drugs that are typically prescribed post-surgery, things like tramadol and oxycodone. And his wife called me the next day, who is my patient, and she asked me to help him because he was not finding the drugs were working effectively enough, and also he was wanting, he was very angry and irritable.
Not a happy camper.
Not a happy camper, exactly. So he then said to me, botanicals will not work to relieve my pain at all. I'm in acute pain, and he was quite irritable and angry with me on the phone as well in the consultation. Needless to say, I ignored him completely and prescribed the botanicals.
Good job, doctor.
Yes, exactly. But prescribed the botanicals that I know work, and some of those are nervogesic and also I find the Boswellia complex, the turmeric forte, and the Gota Cola complex can be incredibly beneficial among some of them because they have amazing healing and pain relieving abilities.
They do.
And he, within 6 hours, he phoned me back and he said, I can't believe how well these herbs are working and how much my pain has dissipated. So he was then a convert from then on, and needless to say, he had multiple surgeries using only the herbs, no drugs, and he's had amazing recovery. So, you know, I've got countless cases like this where herbs are incredibly powerful if used in the right way, and that's why you need to see your health professional as well and not self-diagnose and self-treat, because you will make the mistake of not choosing the right things and you actually waste a lot more money. You know, you really do. I've had patients that bring copious amounts of bags of supplements to my practice in the first consultation, and a lot of it is trash, and we actually throw it in the trash. So you do need to consult with your health professional, the wonderful Mark, for example, and make sure that you are getting the right care, the very precise, accurate care that you need. And that's why we're all here attending seminars, investing our own personal time to learn all the time. It never stops, so that we can be the experts and help you, rather than you trying to find the information maybe on the internet and then not necessarily choosing the right supplements, or not necessarily getting the right quality supplements, maybe even a combination of the both, which is most common.
Well, Amanda, I can't thank you enough for sharing with our viewers here all this great information, because again, this is what you need to hear, because it's like we don't just go looking for any kind of like skull cap or all the different herbs that we have. We're looking for the best, and we've got them right here. So Amanda, thank you again very much
so
for
much. Thank you.
speaking to our,
thank you everyone,
and we will see you next time.
Right, no worries, mate.
No worries, mate.